How should clinical professionals support mental health consumers who become ill when working in a social enterprise? Lori might make a comment afterwards, but Doug, hope that's okay. Just like you to go first and talk a little bit about your view of clinical supports for people who are working in social enterprises or who are supported by social enterprises working in the community
to participate. Can everyone hear me okay? Yeah. Okay, very good. Yeah, so by way of a bit of an introduction, I hold a master's degree in vocational rehabilitation counseling and a doctorate specializing in rehabilitation and neuropsychology. I operate a number of clinics and services, and for purposes here, I'll just describe our RTW Integrated Health Management follows the social enterprise model. We're primary operation is that of an interdisciplinary rehabilitation facility, providing clinical evaluation and treatment for brain injury, chronic pain, mental health, and other complex disability populations. And in terms of our social enterprise mandate, it's largely focused on the indigenous community, providing multidisciplinary wraparound in-home occupational therapy intervention, clinical and vocational programs, fetal alcohol services and advocacy, as well as related competency building within the community. I also oversee a firm specializing in rehabilitation outcome and multidisciplinary clinical functional vocational outcome measurement, with emphasis on mental health and cognitive impairment. That's in association with University of Toronto Scarborough and the support of MIDAC acceleration grants. For purposes of this talk, I really want to first of all reference and really offer Lori kudos to her and her team. I think she very much described really the ideal scenario in the sense that of being a very well integrated approach with both clinical and employment supports and very well coordinated and integrated. I think that really is something that we would all aspire to and with most social enterprises and the social enterprise really milieu. Unfortunately, in most contexts, in most areas, I think, of the country, depending on whether it's a rural or a semi-rural or an urban environment, there are various levels of clinical accessibility for folks with mental health needs. So it really depends on the community resources, and it depends largely on how quickly resources can be accessed. So, for example, an individual who's on a job with a social enterprise, whose mental health concerns begin to escalate, ideally, as Lori would suggest, the clinical team would be well aware of this and could intensify their efforts, provide whatever types of additional support. In addition, there would be consideration of, from the get-go, of the most appropriate accommodations and or modifications and or types of employment settings that best work with the individual's mental health and employment profile. However, that's oftentimes not the case in most communities, so that even if somebody had been plugged into the mental health system previously and they've been discharged or only being lightly monitored, oftentimes it's very difficult to get back in for intensive support when needed. Oftentimes, my experience has been that clients will kind of wait kind of too long before making the request for any kind of intervention, kind of hoping that it might be a mild flare-up that's going to settle on its own. And obviously, by waiting, and you're dealing with waiting lists oftentimes to get back into a clinical service, which could be problematic. In some cases, they can take weeks to months to be reestablished. Family physicians, increasingly in different communities, are playing the role of kind of mental health gatekeeper and kind of first resort prescriber of psychotropic medications, which themselves are problematic because many psychotropic medications will take weeks, if not months, to reach full therapeutic level. So you can have somebody who has been realize to really the best course for them is psychotropics and/or a combination of psychotropics with a talk therapy, for example. But if your psychotropics aren't going to kick in for some time, then obviously that's going to be very problematic and likely beyond the window in terms of managing work and at a productive and satisfactory kind of level.
So I'm going to have to stop you there. I'm sorry, Doug. We just want to move it on a little bit. So if I could, I'll just ask Lori to make any comments she has about sort of clinical supports.